Part 2, Summertime Living with MG. So, in Part 1, I discussed some of the symptoms that a person with myasthenia gravis goes through. Well, this right here is one of the main meds that I take. And I don't know, the label's kind of wore out, but as you can see, I take 2 pills, 60 milligrams a tablet, 3 times a day, and sometimes you can add an extra pill in there because I believe the maximum dosage you can take is 500 milligrams of this in one day and not to overdose on it. So I use that in order to help boost the receptors to send the message to my muscles in ordering them to function a little bit. Before I got on the Vyvgart infusions, I probably was operating at maybe 30% muscle strength. And so with the infusions, I say I'm about 60% muscle strength. And, it's a lot to deal with. But the side effects to this drug here, this drug causes your muscles to pretty much twitch because it's sending the receptors. It's sending strength to the receptors, so your muscles are getting little shocks. So they're twitching, which entails, for me, it produces severe cramping. Cramping to which is also debilitating. And you get them in the weirdest spots. Like, if I'm not having double vision, or even when I'm having double vision, I normally try not to drive, but when you fend for yourself, you have to drive to appointments more so than anything, especially in the summertime. The only time I go out is to go to a doctor's appointment. But these cramps are so severe to where I myself, I break out into cold sweats. That's my body response to pain. And a lot of times when I go to my doctor, they say, Mr. Taylor, do you have any pain or anything? And I always say, no, I don't have any pain. But that's not the truth, because during the cramp and after the cramp, my muscles are sore. And so, yeah, I am in pain. I'm not a big person on pain meds though. So, I feel as though right now I take enough medicine. I don't need to add any more to the plate. A lot of us take prednisone. I'm prescribed it. I don't take it anymore. Prednisone caused more damage than it did help, in my opinion. So all those who out there who suffer from this chronic illness, to those that say, oh, you don't look sick, to those that say, I'm sorry that you're going through this, God is only going to put more on a person than he can handle. And I feel as though he put this on my shoulders so that I can explain and help others through it as I struggle through it myself. So, life's crazy. MG's even crazier. There's another issue we have with breathing. When you go into crises, especially a lot during the summertime, there are a lot of muscles in your body that you don't realize that are actual muscles. Your diaphragm, for one. So your diaphragm affects your breathing because your lungs can expand enough to take a full breath, so it feels like you're suffocating. And cannot tell you how terrifying it is. And in my first experiences with it, I recall sitting up, scared to lay down because it felt like someone was sitting on my chest. I really couldn't sleep then. Positioning myself a certain type of way until I went to the emergency room, and every test they ran on me came back normal. Oxygen levels, this, that, and the other. And in my research, come to find out, it was my diaphragm not expanded enough. So therefore, all my levels would come back normal. It's just my lungs weren't expanding enough for me to actually breathe the way I wanted to breathe. So if anybody out there experienced this with MG, my advice to you is to stay calm, patient, and try not to panic. This is part 2 of the story, Summertime with MG, for TikTok.